Hey, hey, what is going on? Dr. Delon Canterbury, CEO and President of Geriatrics. I hope you guys are off to a great day, having a great week. I have to share, it's been an amazing past few couple of days. In fact, 2022 is looking very bright for me, very bright for geriatrics, and very bright for our healthcare system as we start to change the way we use pharmacists and change the way we approach healthcare with our Deprescribing Accelerator. So I am excited to share that I've had the opportunity to meet with two prospective clients internationally. So this was amazing. I never thought I would learn so much about the healthcare landscapes in Canada, as well as the health landscape and the role of the pharmacists in the Middle East. So we had an amazing discussion today with a potential client who's also an amazing pharmacist over in Jordan. And so this was so cool. She showed me how much there was a little bit of a difference in how they perceive not only medication management, but a different philosophy about medications altogether. So I had no idea that they primarily focus on, particularly in Jordan, on always using the best drug whenever possible. There's really never any other option for considering stopping medication safely or really looking to reduce unnecessary burden. It's always let's go for 100. And so I thought it was so interesting because when I started using the term deprescribing, it wasn't really commonly discussed. She wasn't sure if it was a cultural barrier or if it was just a new thing, but that type of mentality just didn't really exist at all in Jordan. And so she is so excited about this accelerator program. She's looking to see how she can implement this and try to influence a cultural shift, which is exactly what this Deprescribing Accelerator is about. So I am excited to say that we've had one of our first international consultations with someone based out in Jordan who is looking to use this course to not only excel in her profession, but again, to influence other pharmacists and healthcare providers on the impact of safely stopping harmful meds. I also had a great time speaking last week with a potential client based out in Canada. And she is launching a new outpatient clinic, which is so sick. So they're a little bit more progressive. They're looking to integrate basically holistic health in a mixture of having an interdisciplinary team. They're going to have pharmacists, they're going to have social workers, patient care navigators, caregiver advocates, of course, physicians in this outpatient clinic. But unfortunately, I had no idea that there's a huge resignation in medical providers as well in Canada. It goes to show that they're actually just as frustrated as I am with their healthcare system. And so a lot of mid-level providers, pharmacists and doctors are literally leaving the socialized international healthcare system that they have to start their own practice. So imagine, again, they were intrigued by this concept of stopping harmful medications, starting a potentially new revenue stream, and expanding their scope of services and practices by leveraging their pharmacists, but by also empowering their team on how to best advocate for stopping unnecessary meds. So I had no idea, again, that Canada was going through a similar culture shift that we're seeing here with this great resignation during COVID. Not only are they burned out, but they're finding that their own system, as much as I thought it was better than ours, is broken in its own way. In fact, it's leaving people falling through the cracks as much as ours. And what was even more shocking was that they don't even talk about deprescribing. And she even quoted, in all 30 of her years as being a caregiver advocate and working in the senior care space, she has not even heard of that term. So I found it extremely odd that here she is, a director of an amazing outpatient clinic and caregiver service group where it's not being commonly discussed. So again, we're not doing the best job talking about it here, left and right, but getting the foresight on what other countries are dealing with and their barriers to deprescribing is so intriguing to hear. So this was just as fulfilling for me as it was for me to introduce them to this amazing program and continue to expand the reach of geriatrics. So yeah, we are international, baby. We are not going to stop. We're going to keep showing that this is the way. This is the power of not just pharmacists, but what our healthcare system has to embody. We have to look for sustainable, cost-effective ways to reduce harm, to reduce the fact that 750 seniors are sent to the hospital each day because of medication errors. So I'm telling you, it is doable. The enrollment period is close to an end. I am grateful to even share that we are about to max out at our cohort spots. So we only have a few spots left out of the 10 or 12. So if you are interested, join our wait list or at least apply. Talk to me. Let's see what you're feeling. Let's see what you're about. Basically schedule geriatrics.as.me and we'll discuss and do it under Deprescribing Accelerator. So I'm pumped. I'm excited. I I envisioned this being international, but not as soon as I thought. So again, this is Dr. DeLon Canterbury from Geriatrics. Stay tuned for more. And if you're not able to make this cohort, we do start this one February 5th, but there will be another. So again, this cohort lasts 12 weeks, 3 months. So we'll probably have something mid to late summer, if not early fall. So I'll keep you guys posted. Appreciate you tuning in. We international, baby. I love it. You guys have a good week. Take care.